Associate Professor in Microbiology at the University of Reading, Simon Clarke, joins me now from Reading in the UK. Lovely to have you on. I know that's a lot to pour in terms of the types of variants, but my understanding is that basically we're in a very tight race. On the one hand, we as humans, we're trying to get as many people as vaccinated as possible. On the other hand, you have a virus, because of these variants, are trying to, get one step ahead of us in terms of the variants and our capacity to gain herd immunity. Is that the case?
Yes, we're in a situation where we're vaccinating in some parts of the world, like the UK and Israel, even the United States, very rapidly. We're increasing the coverage of the vaccine throughout the population really quite fast. But we see from around the world, in vaccinated populations and unvaccinated populations, the occurrence of a bunch, really, of variants, some of which appear to transmit better, and some of which are more able to evade the immune system. There's also a growing body of evidence that the UK strain is just more virulent, more able to cause disease. So really, we're getting all these things happening at once. And the real problems occur, the really serious problems occur, when we get them happening in more than one variant. So you can end up with a more transmissible and potentially immune-resistant variant causing problems.
That's exactly what I want to ask you in terms of my next question. Which is more concerning to us? Is it the fact that these variants are more transmissible by about 20 to 50%, or the fact that they can lead to a more severe disease?
All of these things are bad, but if you have a more transmissible strain, something which infects more people, then the overall toll it takes on human health can be greater than a variant which is just as transmissible as the versions you had before, but is more able to cause disease. So it depends how you carve it up, really.
Another concern is that these new variants sort of can escape the immunity elicited by natural infection or current vaccination efforts. Agree?
Yeah. Yes, there is growing evidence that the South African variant is able to resist at least some of the vaccines, the Oxford-AstraZeneca vaccine, Sputnik V. But also it needs to be remembered, if we look to Brazil, that the strain that's causing problems over there, or the variant causing problems, appears to be resistant to the post-infection immunity that you get after you've had your first infection.
As a microbiologist, which of these variants is most concerning to you?
I think longer term, it is the one that is resistant to immunity, or any that are resistant to immunity, because that just makes it so much more difficult to control.
Okay. Simon Clarke, we'll leave it there. Thank you very much for joining us.